Okay.
Hello, and welcome to ASPMN's Spotlight Interview. And today we have Dr. Susan Holmes Walker. She is an ASPMN member. She is the ASPMN Great Lakes Chapter President. She is also the lead consultant at the Sullen Group LLC in Southfield, Michigan. She works for Henry Ford Hospital in Detroit, Michigan as a quality risk specialist. And her education, she graduated from the University of Michigan with her bachelor's in nursing, her master's of science in community health nursing. She has a postmaster's certificate as a clinical nurse specialist from Michigan State University. And she also has her doctorate in health promotion and risk reduction from the University of Michigan. Dr. Holmes, it is so wonderful to have you.
Thank you, Tara. And it is a pleasure to be here.
And would you mind for the interview if I just called you Susan?
That is fine. Thank you.
So let's get started. We're going to have 3 rounds of questions. We just want to have a conversation about your experience and your journey in the organization and in your work with pain management. So our first round of questions has to do with your nursing and your pain management experience and ASPMN. Tell us a little bit about how you became a pain nurse and how you got into pain management and what led you to joining the organization.
So I began my journey in nursing back in the late 80s when I was a nursing student at U of M. I graduated and began working on med-surg units, as a lot of us do, to start my career. I worked on mostly surgical units, and early on, I realized the importance of pain management, developing a relationship with your patients, communicating with them, and hearing how they expressed pain or any type of other discomfort or any issues they had during their hospital stay. I always made an effort to establish good relationships with my patients so they felt comfortable sharing things. And I also felt like early on I was an advocate for my patients. So if something wasn't going right or if something wasn't being taken care of, I had no qualms going to the providers to say, hey, we need to do something different to help this patient. And we all know that activity is a big part of recuperation in the hospital, and getting our patients up and moving is oftentimes limited when they're in pain. So it was just natural to see the importance of pain when you're trying to turn patients to prevent pressure injuries, when you want them to get up and moving, coughing and deep breathing, when you're doing dressing changes. We all know that trying to manage pain ahead of when it's going to occur is a big thing. So I've always been a proponent of that. And then probably about 10 or 15 years into my career, I got the opportunity to work as a nurse on the acute pain service at the University of Michigan. So I was working on my doctorate and I was working part-time with the pain team, and I worked night shift. And anyone who's worked night shift also knows that that's a nice time to establish relationships, spend time with patients. There's not all that buzz that's going on during the day and during the evening shift. And when I rounded with patients at night, that really gave me the opportunity to talk with them more about their pain and how they felt we were managing their pain, and talking to them about, at that time, we had PCA and epidural therapy, and we would even round down patients who we were just doing a medical consult on as far as medication management for pain, and just talking to those patients, seeing if what we were doing was making a difference, encouraging them to take control and use their PCA button or their epidural dose button, or, ask for medications when they needed them. And then after that experience, the adult CNS who was working with our team retired, and I was given the opportunity to become the adult pain CNS with the Department of Anesthesia at Michigan Medicine, which was formerly the University of Michigan Health System. And so in that role, I started working with our anesthesia providers, developing pain management plans, going into multimodal pain management. And in that role, I became a partner with Sandy Merkel, who was the pediatric CNS at that time at Mott Children's Hospital in Ann Arbor. And we developed a great relationship, and she was the one that encouraged me to join ASPMN. And during our time together, we attended a couple of conferences together. We did a lot of work with our Nurse Pain and Comfort Committee, offering CEs, expanding knowledge and information about quality pain assessment and management. I'm at U of M and even throughout Southeast Michigan, where we held a annual conference on pain, where nurses could come and get presentations and information and CEs on pain management. So that's my story of getting into pain.
So tell me a little bit about this interaction you had with Sandy Markle when you were introduced to ASPMN. What were some of the resources that you were introduced to?
So Sandy shared the benefits of the organization, just having like-minded individuals looking into the evidence and the research and exploring the reasons why patients struggle with pain and what we could do as nurses to improve. So just having access to the journals, the many continuing education opportunities, going to the conference and actually being able to interact with people and share our successes and some of our challenges with pain management, because it seems as if pain, when, this public social kind of agenda was that pain was the fifth vital sign, we got a lot of attention, a lot of resources. And I think as of late, we've noticed that some of the focus on pain has kind of dissipated, which is kind of frustrating for some of us that still work in pain management, that we've had to kind of shift our focus. But she definitely encouraged and educated me on the importance of evidence-based practice, providing, rationale and documentation for why we do things. And we used a lot of our work to inform our policies. When we worked on our hospital-wide pain committees, we were able to bring evidence and support about how to monitor patients appropriately, how to properly assess and manage pain based on the patient's responses to our treatments and knowing what the best approaches would be. Use a lot of the ASPMN position statements as our evidence. We used to do surveys of patients. We took a lot of effort to survey our nursing staff to see what their education needs were, see where their gaps in understanding were. And then again, we worked closely with our anesthesia providers to try to come up with better plans. So, during my time there, we developed multimodal pain management plans specifically for hip and knee replacement patients. And most of us know back when I started as a nurse, someone had a total knee or total hip. You didn't even get them out of bed for 2 or 3 days. And pain was often a limiting factor with their participation in PT and all those other resources. And now with these multimodal pain management plans that are evidence-based and patients are appropriately educated on the background of why using different types of medications work, most of us know that hip and knee replacement can go home the day of surgery or at the latest the day after, because their pain control is better. They're able to participate in therapies and reach their goals. And everybody wants to get home and recuperate. And that's been successful based on that plan.
So take a minute or two and tell us a little bit more about once you were a clinical nurse specialist, you had met Sandy Markle, you guys are on the ASPMN, in the ASPMN organization, using the resources, the journal, the position statements, engaging in all of the networking opportunities. What additional things did happen in your path or your journey with pain management?
So using those resources just helped keep me educated and informed on changes that were going on in pain management. And after speaking at a case management conference, actually, I was approached by a case manager who worked in workman's comp to say that she had a company that had a non-opioid pain management device. And would I consider partnering with them to offer education to insurance adjusters and case managers on the importance of using multimodal types of pain management and avoiding opioids? So that is how I started my business, which is a selling group. And the goal of that is to consult and provide continuing education to healthcare professionals of all levels about the importance of quality pain management, quality pain assessment, and the benefits of using multimodal therapy and not always just focusing on opioids. And we know, I think nursing, in my opinion, has been ahead of the game with a lot of education about pain management and comfort. And it's nice to see that our other professions are now requiring some type of pain, continuing education to renew their license. And given the opioid epidemic and how it's crossed all racial, socioeconomic populations, and I think for years we felt like opioids misuse only affected certain populations, but now that we see it can affect anyone at any given time, any age, the importance of having that education out there for anyone who interacts with patients, whether they're a nurse, social worker, physical therapist, whoever. It's important that we're all informed and have a good foundation of what the importance of pain management assessment and knowing and figuring out what our patients need.
Yeah, and that's really important. And that's one of the things that ASPMN has really been forging ahead on, is looking at the importance of multimodal, non-pharmacologic pain management. In closing, Susan, can you just tell us what are some highlights to your career? What is information you think that all people who manage pain, even nurses, should know? And what is something that you want everyone to know about your career and your work with pain management and ASPMN?
I think that at this stage in my career, I've always been an educator and I've always loved to teach. And I've always been a lifelong learner. So I think that has served me well. And I think a career in nursing offers you the opportunities to do a lot of things. There's different ways to affect patient care. And I think, in my opinion, my career has taken a lot of twists and turns, but it all has led me to this place where I am today, where I can confidently speak on the research and educate and talk to patients, as well as my, interprofessional healthcare colleagues about pain management, the importance of it. And I'm in a happy place. I think I have a full-time job. I work in patient safety. And I see even in patient safety, the impact of pain management. When we think of COVID patients and they're proning and being put in a lot of these different positions where pain and comfort are still important, and it's important to manage that. And I spoke a little bit ago about pressure injuries and repositioning. And so I still think pain should still be kept in the forefront. I think that I'm going to make a more concerted effort this year to try to reach out to my nurse colleagues and encourage them to join our organization and tap into the resources and educate themselves and inform themselves more about pain management, and that it continues to be an issue. We continue to need to educate ourselves and learn more, because it is still an issue, whether it's still in the forefront. I think the COVID pandemic has shifted a lot of things, but we all know that pain is still there and needs to be properly managed and controlled. And so I'm excited about what the year has to hold. I'm getting some new speaking opportunities from other healthcare professionals to speak about opioids, because we know, all of us know, that pain and opiate misuse gets to all of our patients. And it's important for all healthcare professionals, no matter what your focus or your specialty is, have some knowledge and information and understanding of the importance of pain management and how to properly assess and treat our patients.
Wonderful. And what challenges do you think? What do you think is the biggest challenge right now to putting pain back in the forefront, not just for nurses, but I think healthcare in general?
Mm-hmm. I think the biggest challenges have to be our strategic plans and our focus of our healthcare systems. I think readmissions has taken a kind of a forefront for some chronic illnesses. We all know that cardiovascular conditions have a high percentage of readmissions. A lot of our pulmonary conditions, I'm speaking specifically to congestive heart failure and COPD. And I think a lot of those cardiovascular health issues are getting more attention because of the financial impact on healthcare systems with reimbursement for readmissions. But when you look at those diagnoses, there still can be a component of pain. And we know there's hundreds of millions of Americans living with chronic pain. We have diabetics, we have neuropathy, we have patients that have cardiovascular disease, that have ischemia that causes pain. Pain is everywhere, and I think maybe we need to learn to better embed it in along with some of those readmission prevention strategies and try to find opportunities when we can to bring it into the discussion that it is a factor and can be a factor with readmissions, with prolonged hospital stays, and things that occur to our patients in the hospital. So I think we're going to have to learn to be creative in 2022 to make sure pain is still in those conversations that are being had about how do we promote quality care for patients, how do we get them the services they need, how do we keep them from being readmitted from to the hospital after discharge. We want to make sure we're addressing all of their needs. And oftentimes it's not what brought them into the hospital that's an underlying issue primarily. You know, we have complex patients these days that have a lot of issues, and we need to make sure that while we have them in our settings, whether it's acute care or ambulatory care, that we're assessing the whole patient and trying to figure out what can we do to manage this entire person and not just the diabetic or the person that has high blood pressure, or we need to have a more comprehensive assessment approach so we better understand our patients and know what we can do to offer them relief from pain and any other conditions that they have.
You know, Dr. Holmes, you really bring up an excellent point, especially when you talk about readmissions, because the patient isn't going to be in the hospital very long, especially in this COVID-19 world. So the issue becomes, what are we providing in the community? What is that comprehensive plan that crosses over from the inpatient stay back into the community so that we have that continuation of care that's in the community? That is a great question, maybe for another interview. Thank you. Susan, I just want to ask you one more question. Tell us a little bit about your role as the ASPMN Great Lakes chapter member. What are you doing there?
So I think we have a small but mighty group of pain nurses in our Great Lakes chapter of ASPMN. We are in our third year of having an interprofessional continuing education series. This year we will have nurse presenters, we will have a child life specialist, we'll have a social worker, and a pharmacist provide continuing education opportunities. And our actually first event of the year will be a diversity, equity, and inclusion focused presentation when we am talking about pain management in the context of DEI and all those issues.
But also looking at diversity, equity, inclusion, and belonging. And we just started a new committee. So that's really exciting as well. And our new diversity statement that we just put together. So ASPMN is right there with you in agreement in all of these things that we need to be working on. So excellent.
So we work hard. I think we support each other. We definitely talk about our professional issues, but I think it's important to have a support group of pain professionals because we all verbalize the same thing. We see that, you know, the focus on pain has kind of gone away from a lot of our settings. Most of us work in primary care or ambulatory care. And so we see that the focus on pain is not necessarily at the forefront in our, you know, respective organizations. So we've shared and been able to support each other. And again, we want to reach out to other nurses that aren't involved in ASPMN and encourage them to join the group and get access to the resources and information that we have. And offering this continuing education series, I think is a nice way to introduce them to our group and hopefully generate some interest in joining ASPMN and becoming active members.
So, what are some of the other things that your chapter and the national organization offer? You talked about this interprofessional series. What other benefits are there to joining the local chapter and the national organization?
I think we have access to the Pain Management Nursing Journal. There's all types of educational opportunities. We have our annual conference every year. There's listserv conversations. There's just a plethora, a huge amount of resources and information that's available. One thing our chapter is going to focus on this year is having a little bit more political and social kind of advocacy presence. In the state of Michigan, there's currently a bill on the table to promote and allow nurse practitioners to function independent of a physician and practice to the full extent of their license. So we actually have encouraged our chapter members to write letters to their congressmen to support the bill. We provided templates and phrasing to use because it is important for nurses to be able to practice to the full extent of their license. And a lot of times our nurse practitioners are reaching patients that have those, that need that comprehensive assessment. And that's what nurse practitioners are trained to do, be able to help the whole entire patient, including patients that have pain issues, and be able to operate and function to the extent of their training and their license. So we actually launched this year a scholarship award. So we will rotate 1 year. We will offer support to take the pain certification exam. And then in the alternate year, we will offer some support to attend the national conference. So we are trying to make a difference, offer some support, because we know a lot of times it can be a financial barrier that keeps you from participating in things. But that is something we've also worked on for our chapter.
Thank you. That's wonderful. And I do know at the national level, they're also offering conferences virtual so that people can attend as well as face to face. So we'll see what this year brings you. So I just want to thank you, Susan, for this wonderful spotlight interview. And we look forward to talking to you again.
All right. Thank you. I look forward to another opportunity in the future.